I have found that my passion exists in helping individuals who suffer from mental health and substance abuse conditions and plan to direct my practice professionally in this field. There is a mental health crisis in America, and people who suffer from mental illness have limited or no access to mental health services in the communities across the country. I hope to assist in breaking down the barriers that exist for my clients by using the strengths, skill sets, and knowledge that I've gained at the Kent School of Social Work that will facilitate my ability to promote social justice and address the complex practice situations that I will face as a professional social worker. I have learned that not one single theory can explain everything, but can give you a framework for understanding, predicting outcomes, and can help guide practice. The system theory explains that human behavior is solely a product of one's environment. When assessing a client, this theory states that we must look at the individual issues, family, culture, and other systems that could impact the client and their situation. Using this theory with individuals who suffer from mental illness and substance abuse has allowed me to holistically assess their situation, and hopefully I will be able to employ an appropriate intervention and could strengthen one weak link in the client's system. With mental health and substance abuse being what drew me to social work, I sought a practicum setting that would facilitate further learning in these areas. Through psychiatric social work in a level 1 trauma center and being on the mobile crisis team responding to psychiatric crisis in the community, I found that there is a tremendous deficit in mental health resources available to people who are living in poverty. With few mental health providers in the community, this causes individuals to travel to seek mental health treatment, and for someone who lives in poverty, this may not be an option. Another barrier to mental health care is time. Because there is a lack of providers, wait times to get into an office can be extensive, along with long wait times in emergency rooms that can also have a negative impact on people who are going to the emergency room not in psychiatric crisis. Along with the barriers identified, I also have found that there's an issue of health insurance. Many of the clients that I've encountered within this population did not have health insurance. The result of this is a lack of providers that will accept a patient without the insurance, or if they will accept the patient, there is a large out-of-pocket expense that for a person living in poverty is not reasonable. Within my practicum setting, I've been able to advocate and promote social justice through collaborating with my supervisor and creating a brochure of local mental health and substance abuse resources to give clients that is easy to understand and lists the out-of-pocket expense that they can expect, the hours, location, and telephone number of the agency. This brochure has been recently approved by the agency and has started to be distributed throughout my community. I also have had the opportunity to share research and education pertaining to the benefits of using telemedicine in emergency rooms and have that have to be sent to for emergency rooms that have to send their clients off-site for further psychiatric evaluation. I created a quick reference tool for agency staff that identifies when it is appropriate and not appropriate to use telemedicine in emergency rooms. I also created an educational brochure for clients in the ER so that they can better understand telemedicine and its benefits. These tools have been stepping stones to improving practice, which will promote positive outcomes for clients, educate my community, and hopefully empower others to promote social justice. I chose to participate in the advocacy projects that I did with the hopes of expanding knowledge that individuals have about mental health and substance abuse, while anticipating that this process would create a better opportunity for this population to gain access to available mental health care services in their community. with the ultimate goal of improved access and availability to mental health services for clients and communities that are well educated about mental health and the resources that are available in this community. Finding the area in which I intend to direct my practice